inside their ears. They had suffered from a chronic ear infection over the summer months and were given multiple antibiotics. They felt as though the course of antibiotics helped reduce the inflammation of the ear, and it did improve their symptoms, but it left them with this sharp pain. Now, upon appearance, to me at least, it looks like dry blood. So it could have been whilst as this patient was experiencing their chronic ear infections, they were also having some bleeding in the ear, and either just through the natural healing process or via the antibiotics, the blood had become crusted and dried, and it settled not only on the eardrum but on the medial canal wall, so it's on the bony part. Very difficult to remove for that reason, because the patient's already come in reporting pain in the ear, and we're then tasked to remove this off their eardrum. I immediately put some drops in. Now guys, I have sped the video up slightly, so the speed is 1x4 the normal speed. It's just so I can get the video under 10 minutes, which then allows me to upload it on Instagram, because Instagram's got a 10-minute limit. So you may not notice it's the difference, to truth be told, but I just thought I'd let you know. So I put some drops in initially. I used a fine end suction probe just to lift this crusted skin off the eardrum. I then had a little flap that I could use to grip onto using forceps. I managed to remove the back part of this crusted dry blood. Now, on the roof of the ear canal, this is the superior part, and this is the part that typically patients find quite uncomfortable, that this particular region, and that's because the top part of the eardrum is called the pars flaccida. It's a very thin part of the eardrum. It's a lot more flaccid, hence the name pars flaccida, compared to the rest of the eardrum, which is a lot more taut. So you can think about the eardrum in two regions. The main body of the eardrum we call the pars tensa. And again, the clue's in the name. Tensa, it's stronger, it's got all the radial muscles, whereas the pars flaccida, the top part of the eardrum, is a lot more flaccid and turgid, and therefore it's just a bit more sensitive in my experience when we're working at the top part of the eardrum. Nonetheless, we managed to get that crusted skin off the top part. We're now working in the inferior and anterior recess. Again, some more dry blood. We have to be so careful just to lift this off the canal wall without making contact with the ear canal, because the bony part of the ear canal, if you've been watching my videos, you'll be aware that it's very sensitive. It's literally a very thin layer of skin, less than 0.1 millimeters in thickness, that's lining the bone, and it's directly on top of the bone. There's no fatty tissue or cartilage. So similar to before, I managed to lift the dry blood off the canal wall, and then which enabled me to insert some fine jaw forceps into the ear to extract it. Just some residual dry blood on the eardrum. This is not going to cause the patient that much mischief, because it's not crusted in any way. It's no sharp edges. It's just a very thin layer. You can just see how close we are to the canal wall on the right hand side, and be really careful just to avoid contact there. There's a little hair strand that was attached to this, which also came out. So that's the patient's right ear. The left ear, I feel, was a bit more complex. It was a lot more crusted. I actually did put drops in straight away, but it didn't really have much effect. It didn't really soften this crusted dry blood. So just on the base of the ear canal, I'm trying to lift this off the canal wall. It's just really stubborn. It's a lot more cemented. So I decided to go to the roof of the ear canal instead. And again, we're just trying to bring this down. You can see it's almost like removing a stamp off an envelope. We have to be so gentle. So managed to just elevate this crusted dry skin off the roof of the ear canal and actually at the top part of the eardrum. Again, I've got something to grip onto now, so I'm going to go with some forceps. Now the patient had really narrow ears, so it's a very minimal. We're short of space in there to use some of these instruments. So in terms of manoeuvrability, it was quite tricky. Nonetheless, managed to get the top part of the ear canal clear. I put some more drops in. I'm just going back for the base of the ear canal. I've managed to just lift this crust off the back part of the ear canal and also the base. And I think, again, in a minute, I'm going to use some forceps. You can see I've just lifted it. Just going to use some forceps. I'll be so gentle here. Don't want to make contact with the bony part of the ear canal at all. Now, these forceps are really, really small. They're fine jaw ones, but you can see how magnified they look in the ear. So just working on the anterior canal wall. So I'm just gliding the fine end suction probe against the canal wall. This is partly on the cartilaginous portion, so we can put some pressure, and then I'm going away towards the eardrum now. Going to be a lot more careful. And once again, I'm going to go back in with the forceps and just use it to peel this off. I think I'm going to use forceps. I might be wrong. Let's see. It's got quite a bendy ear, so it's difficult. I mean, with a lot of these instruments are carbon fibre, they're not bendy. So we have to really stretch the ear open to get the instrument in. You can see the forceps really do fill up the ear, and it just gives you a perspective of how narrow the ear canal is, because these are, and also how magnified the view is, because these forceps are really, really micro. So I'm just going to go back in and remove this final piece that detached itself. Okay, so the majority of the eardrum is now visible. There's just some crusted dry blood on this region. It's just before the isthmus, so you can probably see the canal, the perimeter where it narrows. We call that the isthmus, so everyone or most people have a natural narrowing of the ear canal, about 0.5 centimetre away from the eardrum, and then the ear canal widens again. We call that the isthmus. So this is just hovering over the isthmus. I think I'm going to put some more drops in. So I put drops in quite a few occasions. I'm using sodium bicarbonate drops. I just find it works better with dry blood and dead skin. There we are. We managed to just elevate it, retract it off the canal wall. So it's just this last bit on the back part of the eardrum. This is, again, a very sensitive area, and you'll see me tackle that in a moment. What I initially tried to do is see if I could peel it off the eardrum and then come back, because I'll rather actually, believe it or not, work on the eardrum as opposed to the bony part of the ear canal, because the bony part's a lot more sensitive. So you can see I'm actually on the eardrum. I'm trying to suction it and pull it away and hoping all of it detaches, but it didn't, so I had no choice. Well, I had a choice. I could leave it, but I felt confident doing it, and the patient was very still. So I went on the bony part, peeling it off, and I'm going to take it off the eardrum. Now you're going to see some residual dry blood on the eardrum. I'm not going to remove all of that because it's just impossible. Some of it just has to migrate off naturally, but all the sharp ridges, all the bit around the perimeter of the canal wall that was digging into the canal wall has all been removed. Just taking some off the handle of the hammer bone, so the handle of malleus. We also call it the manubrium. There's some on the umbo, so the middle of the eardrum where the hammer bone attaches itself. This is the umbo region. I've managed to gently remove that now. I think I'm going to stop in a minute. So the patient did start suffering from the caloric effect, was getting a bit dizzy. Sometimes we do suction, you can experience a bit of vertigo. It's short lasting, but it can throw people off a bit. It's very rare, but it can happen, especially when we work so close to the eardrum. There's just a bit of dry blood at the bottom of the eardrum here, so I'm just seeing if that comes off easily. I think I managed to get a bit off, and that's it. I'm more than happy with that. It's a lot more than I thought I'll achieve.